Especially you have to take care of the opposite gender, especially XX gender. So male mentee, that's why we are always trying to give the same gender mentor and mentee. But as usual, the ratio in medical college is slightly lower in the females. That's why we have to face it. But really it is the careful and red flag for XY mentors. You have to make the rapport. Second thing, you have to contracting and direction setting. Whatever the goal, whatever the problems your mentee has, you have to be in the direction. You have to give some progress with maturity, and at the end, the session should be closed with satisfaction of the mentee. These are the key features. First one is very difficult for us. Sharad has told, experienced teacher, and it is the drawback of the experienced teacher that always he wants that my students should listen to him. So active listening is very difficult for a mentor. As the age advances, everyone wants to talk. We call as a mic addiction. So you should be active listener to the students, active listener to your mentee. And once you are active listener, then 90% problems will be solved. And especially this line is very useful for me. Just keep quiet. Whenever anyone comes to your office, be quiet. Try to keep yourself quiet. Whatever he says. And first thing, his mobile is on your table. He wants to record all the things you. You always keep in mind that as a practitioner also in OPD, every patient is recording you. So be aware. Don't raise your temperature. Don't raise your adrenaline level. Just you have to kill that 10 minutes and try to avoid your primary reaction. You keep quiet, make drama of that you are listening, you will be safe. As a mentee and mentor relation, active listening is a first and basic step. You should follow this. Is very important, and you have to build trust in the mind of mentee that my mentor is listening all the things. He may give the answer, may not give the answer, may give the solution, may not give the solution, but at least he is supporting to me. Then determining goals and building capacity in the mentee is very important, and encouraging and inspiring. Just I have told, it is very difficult to find the role model in your life. Like this, inspiring people are very less in nowadays. Everybody is in hurry and worry, and he don't have time to motivate you, to guide you and inspire you. Just this is again same teacher, coach and mentor. Teaching and coaching is for short term. Mentoring is for long term and very useful for personal development and skill competencies. Now it is time for question. As a rector, student from boys hostel ask permission want to celebrate Holi and Rang Panchami in the hostel. How will you, your mentee has asked your permission as a mentor? What is your suggestion? No public activities or religious celebration will be done in educational campus. Always remember, वाढदिवस साजरा करायचा नाही. And that is not in your hand. First thing, remember, as a mentor, you can't take the decision to give celebration in the campus academic institute. There are certain norms. You have to convince your mentee that this is not in my hand. But remember that this type of celebration, especially religious celebration, are not permitted in educational campus. You go to the dean. That is his headache. As a male teacher, you are the mentor of XX mentee. And this is very difficult, very difficult. Till today, there is no solution for this. At the age of 50, 60, I think 70, 80 also. Khare sir is there, senior people are there. How you solve this issue? As a mentor, first you call the female attendant. That is very important. तिला खुर्चीवर बसव जाव तर दुसऱ्या खुर्चीवर दुसरी female पाहिजे. Always take help of the female. She may be the maushi or your clerk or your colleague or your teacher. Whoever is available in the first second, call her. She should be seated there. Then whatever drama goes next, that is different story. Okay? But that precaution as a mentor, always take. Whenever you are conversing with the female mentee, always there should be one female, or postpone that session, because you are a mentor of this failure student who is failed in practical only, passed in theory, and that is the headache of the HOD. Attendance is 80%. प्रायव्हेटमध्ये अटेंडन्स 80% असतो, कारण गॉडफादर NMCने एक टाइमच पंचिंग करायला लावलं त्यांना, जस्ट डू वन टाइम पंचिंग अँड गो होम. दॅट इज देअर अटेंडन्स नाव. Very important thing sir has pointed out, whenever you are feeling that any student's performance, especially mentee's performance is less, attendance is less, give writing memo. First thing. Second time, same thing is repeated, call his parents, take him in writing. All the things should be in writing, because they blame that your teachers are not good in teaching. My exam was not conducted in fair atmosphere. Whenever my students number was came, external has gone by putting the mobile on his ear and he was outside, so exam was conducted by 2 people only. And same about the opposite gender. There was a bias in me, and that's why I was purposely failed in that situation. So it is very difficult situation we are facing so many times. Counsel properly and coolly. It is not my, it is our only. He was the student of 2008 batch.
नमस्कार. माझी 2008 मध्ये पद्मश्री डॉक्टर विठ्ठलराव विखे पाटील फाउंडेशन मेडिकल कॉलेज अँड हॉस्पिटल अहमदनगर येथे MBBS साठी ऍडमिशन झाली. डॉक्टर होण्याची आणि आई वडिलांचे स्वप्न पूर्ण करण्याची इच्छा मनात घेऊन मी माझ्या फर्स्ट इयरला सुरुवात केली. इथे आल्यावर जे नेहमी मनात होतं ते शिकायला मिळत असल्याने मी खूप खुश होतो. सोबतच माझा परिवार इतका आनंदात होता. हायली क्वालिफाईड प्रोफेसर्स कडनं थेरॉपिकल आणि प्रॅक्टिकल नॉलेज घेत मी माझ्या थर्ड इयर मध्ये आलो. थर्ड इयर मध्ये असताना माझ्या हेल्थ इश्यूजमुळे मला MBBS कंटिन्यू करण्यामध्ये बऱ्याच अडचणी आल्या, ज्यातनं रिकवर व्हायला मला वेळ लागला. तोपर्यंत माझी बॅच ही पास आउट झाली होती. माझे सगळे कलिग्स पुढे गेले आणि मी एकदा मागे राहिलो, हा विचार मला खूप त्रास देत होता. मनात सतत येणाऱ्या या निगेटिव्ह विचाराने मी हळूहळू डिप्रेस होत गेलो आणि MBBS पूर्ण न करण्याचा निर्णय घेतला. त्यात माझ्या फॅमिलीनी पण माझ्यावर जास्त प्रेशर न टाकता मला सपोर्ट केला. फ्युचर सिक्युअर करण्यासाठी वडिलांनी माझ्यासमोर बरेच बिझनेस प्रपोजल ठेवले, ज्यात मी काही दिवस काम पण केले. पण मनात कुठेतरी एक पोकळी निर्माण झाली होती, जी मला सतत बेचैन करत होती. 2018 मध्ये सहज एके दिवशी कॉलेजच्या स्टुडंट सेक्शन मध्ये फोन करून एन्क्वायरी केली की सध्या डीन सर कोण आहेत. पिडियाट्रिक्सचे आमचे प्रोफेसर डॉक्टर सुनील मस्के सर हे सध्या डीन आहेत हे कळाल्यावरती मी वडिलांना त्याच दिवशी बोललो की उद्या आपल्याला कॉलेजला जाऊन सरांना भेटायचं, आणि मी तशी नेक्स्ट डे सरांची अपॉइंटमेंट घेतली. कॉलेजला येत असताना माझ्या आणि वडिलांच्या मनामध्ये असंख्य विचार होते की 5 वर्षाच्या गॅप नंतर सर नेमकी या सिच्युएशनला कशी रिॲक्ट करतील. डीन सरांच्या ऑफिसमध्ये गेल्यावर सरांनी आमचा सगळा प्रॉब्लेम ऐकून घेतला आणि एका क्षणामध्ये मला कॉलेज जॉईनिंगसाठी परमिशन दिली. ज्या गोष्टीची माझ्या मनामध्ये इतक्या वर्षांपासून भीती होती ती सरांनी इतक्या पॉझिटिव्हली ऍक्सेप्ट केली, हे बघून मी आणि माझे वडील हे निश्चिंत झालो आणि माझा कॉन्फिडन्स आणखी वाढला. कॉलेजमध्ये रिजॉईन झाल्यानंतर कम्युनिटी मेडिसिनच्या HOD आणि प्रोफेसर डॉक्टर औचटमॅन आणि प्रोफेसर डॉक्टर गुल सर यांनी मला वेळोवेळी योग्य ते मार्गदर्शन आणि कोऑपरेशन दिलं. अकॅडमिकली इतक्या मागे पडलेल्या स्टुडंटला सगळ्या प्रोफेसर्सकडून मिळत जाणारा हा सपोर्ट माझ्यासाठी इन्स्पिरेशन ठरत गेला आणि मी माझे 100% प्रयत्न देत गेलो. आज मी माझी MBBS ची डिग्री सोबतच माझ्या आई वडिलांचे स्वप्न, डीन सर आणि माझ्या सगळ्या प्रोफेसर्सनी माझ्यामध्ये दाखवलेला हा विश्वास खरा करून दाखवण्यामध्ये यशस्वी झालो. डीन सरांसोबत झालेली माझी ती भेट ही माझ्यासाठी लाईफ चेंजिंग आणि लाईफ मेकिंग ठरली. थँक्यू सो मच सर, मला खऱ्या अर्थाने एक नवीन आयुष्य देण्यासाठी. धन्यवाद.
खरं तर मी अगोदरच माफी मागतो, कारण स्तुती न ऐकावी कानी, निंदा न करावी वदनी. पण मेंटरशिपचा विषय निघाला, यात केवळ मी आहे असं नाहीये. ऑल प्रोफेसर्स 2008 मध्ये ज्या मुलांनी फर्स्ट इयर पास फर्स्ट अटेम्प्ट मध्ये झाला आणि का बरं सोडून गेला, टिल म्हणजे 2009 ते 2018 पर्यंत त्यांनी बरेचसे व्यवसाय केले, सगळे काही त्यांनी जादूटोणे वगैरे सगळे करून झाले. पण हिज फादर वॉज अ डिप्लोमा. माझा काही परिचय नव्हता, पिडियाट्रिशियन होते, केवळ पिडियाट्रिशियन असल्यामुळे आला आणि काही न करता स्वतःच्या भरोशावर ते पास झाला. फक्त त्याला एकच सांगितलं तुम्ही जॉईन होतं आणि प्रत्येक 8 दिवसाला माझ्या ऑफिसला यायचं आणि गुड मॉर्निंग म्हणून जायचं. आणि सगळे वर्ष, काही लोकांना आठवत असेल मला माहित नाही, फर्स्ट अटेम्प्ट मध्ये सगळी वर्ष निघाले. नाव ही डुइंग व्हेरी गुड प्रॅक्टिस इन चिखली. तर दिस इज द वन वे ऑफ गुड मेंटरिंग. ॲज युजल, all relations have good and bad points, outcomes, moments, and it is experienced with effective to dysfunctional. जस्ट थोडंसं थेरॉटिकल पॉइंट्स आहे. रिस्पॉन्सिबिलिटीज ऑफ मेंटी ॲज वेल ॲज मेंटर. कारण आता रिस्पॉन्सिबिलिटी मेंटी समजावून सांगायची वेळ आली आहे मुलांना. यू शुड क्लिअरली कम्युनिकेट देअर पर्सनल अँड प्रोफेशनल गोल टू द मेंटर. ॲक्टिव्हली लिसन टू द मेंटर्स ॲडवाइस अँड फीडबॅक. Implement it in your curriculum. Apply the mentor's guidance to real life situations for growth. Show respect for the mentor's time and expertise. Maintain a positive attitude and willingness to learn, and give constructive feedback to the mentor. These are the SMART goals for this mentoring program. You should be very specific, measurable. Whatever you are telling, that should be measurable. Now you are knowing formative, summative assessment and other things. Every time, especially in the postgraduate department or whatever expectation from your mentee, it should be measurable. It should not be vague that you are good, you are bad. No, it should be very specific. That goal should be attainable. It should not be impossible. And it should be relevant to that mentee. Whether he is the boy or a girl, you should be think in that angle. Whether that girl is possible to do that goal, she should achieve it or not, you should think it. And everything should be time bound. Nowadays, this is also one type of mentoring, e-mentoring, with the help of social media, WhatsApp, mobile. It is also possible to get the good mentors, especially from the abroad in the specific field. And COVID has given this opportunity to all of us that you can be connected in world's any corner for all the good things. Benefits of being a mentee: acquisition of knowledge, you can give good knowledge to the mentee. Development of the professional network, you can increase the confidence of your mentee. Especially helpful in the soft skill development of the communication, leadership, and by virtue of seniority and experience, you can help him in the problem solving also. This is the one line I always like, that here it is a sentence we have written as a guru, but really it is the mentor, that you should remove the small things from your mentee and give him chance to become or make it as a big thing. And it is the real guide, teacher or a mentor who should do this thing, that small things from the mentee, you should identify that, give him scope, give him opportunities to develop into the big goals. आपल्याकडे most of the teachers we don't do it, but especially in the central viva of the governments, they don't ask your degrees, they don't ask your certificates, they only ask the SWOT analysis. Anyone can clarify SWOT analysis? Initially it was called as SWOT analysis, but now it is SWOT analysis. त्यासाठी डिग्री देखील हल्ली कोणी बघत नाही, तुमचे ऍडेड क्वालिफिकेशन नाही, तुमचे एक्सपिरियन्सेस नाही. दे गो ओनली बाय दिस 4 थिंग्स: स्ट्रेंथ, विकनेस, अपॉर्च्युनिटी अँड चॅलेंजेस ऑर थ्रेट्स. 30च्या 30 लोकांनी SWOT analysis बनवावं फक्त तुमच्यासाठी. मग तुम्हाला तुमचे स्ट्रेंथ, विकनेस, तुमच्या अपॉर्च्युनिटीज and challenges करतील. All have written their mentor and mentee goals and ideologies in that will be useful for your day-to-day life. And when you are coming in contact with the academics in the hospital, related to the patient also. This one line of this Kusumagraj, Viva Shurwadkar, this last line is very important. This type of mentor should be there in everybody's life. That's why this mentee has came to meet his teacher. मोडून पडला संसार तरी मोडला नाही कणा. ज्याचं घर पावसात वाहून गेले तो रिक्वेस्ट करतो त्याच्या टीचरला वाटलं आता पैसे मागतो की काय, पण तसं नाहीये. पाठीवरती हात ठेवून तुम्ही फक्त इमोशनल सपोर्ट त्यांना खूप महत्वाचा असतो. दॅट इज ओनली थिंग रिक्वायर्ड फॉर दिस. दीज आर फ्यू हिस्टॉरिकल एक्झाम्पल्स. कारण आपण मायथॉलॉजी मानत नाही, बरेचसे हुशार लोक वेस्टर्नायझेशनच्या इफेक्टमुळे. पण दीज पीपल्स हॅव ऑल्सो मेड taken the mentor's help. Plato was a mentor of Socrates. Alexander the Great, who was the mentee, Aristotle's mentee. Great Newton, his mentor was a Cambridge professor, Isaac Barrow. You might have heard it. So they have not also learned things without the mentor. So your role as a mentor is very, very important in mentee's life. These are the mythological examples. Dronacharya with Arjun, Vasishtha Rishi, Vishwamitra Rishi with Ram Lakshman, Chhatrapati Shivaji Maharaj. Everybody knows this type of mentor should be there. All mentors, all teachers, all guide, all gurus, they stand behind. In every situation, they push you ahead and they stand behind. But here it is, the scenario is different. Madam is there, Kusakar madam. This line is given in the Jnaneshwari. पायकू पाठीशी घातला, आपण पुढा राहिला. किती लोकांना माहिती, मला माहित नाहीये, पण ज्याला माहिती त्याला खरोखर माहिती असेल त्या ओळीचा अर्थ. आणि इट इज व्हेरी व्हेरी इम्पॉर्टंट फॉर द मेंटर. प्रत्येक प्रसंगात तुम्ही पुढे उभं राहायला पाहिजे, गुरुनी पुढे उभं राहायला पाहिजे, टीचरनी पुढे उभं राहायला पाहिजे, मेंटरनी उभं राहायला पाहिजे, गाईडनी पुढे उभं राहायला पाहिजे, स्टुडंट आपल्या मागे पाहिजे. कारण एव्हरीथिंग्स ही विल टॉलरेट, ही विल ऑब्स्ट्रक्ट, देन अँड देन ओनली युअर स्टुडंट विल बी बेनिफिटेड. सिनेरिओ मध्ये आपण पाहतो की श्रीकृष्ण पुढे आणि अर्जुन मागे. मॅनेज द रिलेशनशिप बिटवीन मेंटर अँड मेंटी. E, encourage, recognize the ability of the mentee. N, nurture, that is, create an open, candid environment. T, teaches, creating a stimulating environment that challenges the mentee. O, offers mutual respect. R, responds to mentee's needs. कुठली mentor mentee session should not be outside the मेडिकल कॉलेज अँड हॉस्पिटल प्रिमायसेस. हॉटेलमध्ये नाही, बाहेर एखाद्या टपरीमध्ये नाही, समोरासमोर जिथे लोक विटनेस करतात त्या सेशनमध्ये मेंटर मेंटी मीटिंग व्हायला हव्या. अँड देन अँड देन ओनली यू विल बी इन गुड प्लेस. दिस इज फ्रॉम माय साइड. अगेन थँकफुल फॉर द ऑर्गनायझर्स who has given me opportunity to talk on this very important topic. Though slight inconvenience was made from my side to Vishal. Whenever they are in your course, throughout the course you should be mentor and mentee like we are doing here. But fortunately, if you are lucky, that mentee can be in your contact with your throughout life for academic guidance. Many of the ex-students we call here, they always take our advice for which course I should select for PG, super specialty, or how to do practice. Especially from the clinical side, they take advice. Especially I am also taking my boss advice, though he is 90 years old in Pune. He is Brigadier K.C. Jain. So I always was contacting him, sir. He was expert in renal. So especially nephrotic syndrome regime, because we know it is always changing and prednisolone is many times making the problem. So I was also asking always to him. And second thing, Dr. Jayashree Jadhav in Lonis, who is the HVD in there, I was also contact to her also. They are senior figures. So better to be in contact with your mentor lifelong. Thank you.